Bipolar disorder is a very serious medical condition. It's something that many patients struggle with in silence. The fact is, 20% of depressed bipolar patients attempt suicide, making it a condition we should all learn much more about.
Hi, Anna. Hi, how are you? I'm fine. How are you? It's nice.
Karen Isagian always considered herself a happy and productive person until about 5 years ago when she experienced a deep depression.
I couldn't do the things which I normally did because I normally could, entertain, I could cook, I could, have 50 people over for dinner if I wanted to. And that, so when you've been able to do a lot of things and then all of a sudden you can't really function, you know that there's a reason and that you need help.
How long have you had this dental work?
She was diagnosed with bipolar disorder, also known as manic depressive illness, a brain disorder that causes unusual shifts in a person's mood and energy.
Hi, what do we have?
Hi, doctor. We've got this 29-year-old male.
Dr. Ken Steinbach, medical director at Community Behavioral Health Center, says unfortunately bipolar disorder is often misdiagnosed.
What oftentimes happens is someone will present to a doctor complaining of depression, and so the doctor will start an antidepressant, which is appropriate for depression, but the antidepressant in a bipolar person can take them out of depression and throw them into a manic episode.
Manic episodes are characterized by increased energy, irritability, and poor concentration, poor judgment, drug and alcohol abuse, and denial.
You really have to, try to find a good doctor, someone that you feel very comfortable with, and someone who will listen to you. That is really important.
Like diabetes or heart disease, Dr. Steinbach says that bipolar disorder is a long-term illness that must be carefully managed throughout a person's life.
I don't think I've ever seen a person with bipolar disorder who didn't want to sort of test that theory, so they stopped their medication. And sometimes they can go a long time, they can go a year, a couple years, and they're fine, and so they figure they don't have it.
In a depressive episode, a bipolar patient will lack energy, experience anxiety and guilt, will sleep a lot, have changes in appetite, and thoughts about death.
It's so important to have the support because there were times when I really didn't think I could go on. If I didn't have that support, I think I would have really not have been a survivor today.
Did you guys stay up late?
No.
One of the biggest challenges is the way society tends to view mental illness.
People, I think, are still at a stage where they only recall the last movie they saw where there was, someone in a straitjacket. I mean, that's the biggest misconception, that anyone who has a mental disorder is crazy.
Paul, doesn't the yard look good?
Yes.
People couldn't really talk to me about it. I think if I had had cancer, it would have been more easily accepted.
That's what motivated Karen to create the Valley Women's Health Conference, which she coordinates annually to educate our community about good health.
I really want to help other people have the education to be able to make the right choice for themselves and to maybe not have the experiences that I have.
Karen is back to doing all the things she enjoys. She exercises, is careful about what she eats, and still goes to counseling.
And I take very good care of myself. It's something I learned through my experience that I have to be more responsible for my lifestyle.
Just really enjoy them. Gardening has been very therapeutic for me, too.
I can say no now, whereas before I couldn't say no to myself. I felt I had to do everything that I wanted to and be the perfect person, and so I allow myself the space not to.
Bipolar disorder affects about 3% of the population, and it is hereditary.